bleeding for 2 days and you are concerned, or bleeding for 7 days and you are still concerned? Hello, I am Dr. Abhipsa Mazumdar, consultant Obstetrics and Gynaecology, Manipal Broadway and Salt Lake. Today we will be discussing about abnormal bleeding. Let us first understand what is the normal pattern of bleeding or how it should be normally. Normal menses usually lasts for 2 to 7 days. If you are bleeding for 2 days, that is normal, and if you are bleeding for 7 days, that is also normal. Next, let us discuss about the amount of bleeding. Some people, they complain that they are having very little bleeding. Let me make it clear to you that per day, if you are bleeding for 5 ml, then also it is normal amount of bleeding. 5 to 80 ml of bleeding per day is normal. So how can you quantify your amount of bleeding? It is by the number of pads you use per day. If you are using on an average of 3 to 4 pads, then that is considered to be normal bleeding. But if you are using more than 5 pads per day, you need to visit your gynecologist. Next, what should be your cycle length? That is, in how many days interval you should get your menses. There is also a range. If you are bleeding in every 23 to 35 days, then it is normal. That is, if your menses are coming after every 23 days, that is also normal. Or if you are bleeding after 35 days, that is also normal. So now you are very clear which is abnormal bleeding. There are some places which is concerning. In spite of the fact that you fall in the normal range of bleeding, when should you be concerned? If there is a change of pattern, that is, previously you are bleeding for 4 to 5 days and suddenly the length of the bleeding has increased or decreased for consecutively 3 months. There is a change of pattern. So please visit your doctor so that some problems can be ruled out, because some very common hormonal disorders or very common structural disorders in uterus can cause a change of pattern. Next is if there is pain. Previously you were experiencing little pain, but now if you are experiencing more pain, then you should also go and talk to your doctor. Next comes if you are passing more clots. So 3 important concerning factors can be: 1 is change of pattern, number 2, if there is increased pain during menses, and 3, if there is passage of more amount of clot. Thank you.